Introduction. Dapagliflozin is a medication primarily used to treat type 2 diabetes mellitus, T2DM, to control blood glucose levels, heart failure with reduced ejection fraction, HFrEF, chronic kidney disease, CKD, to prevent disease progression. It belongs to the class of SGLT2 inhibitors, sodium glucose cotransporter 2 inhibitors. Brand names include Forxiga and Farxiga. Fixed-dose combinations include Zigduo XR, dapagliflozin plus metformin; Qtern, dapagliflozin plus saxagliptin; Cutrelmet, dapagliflozin plus saxagliptin plus metformin extended release. Mechanism of action. Primary action: inhibits the SGLT2 transporter in the kidneys, responsible for reabsorbing 90% of glucose filtered by the kidneys. Blocking this transporter increases glucose excretion through urine, lowering blood glucose levels. Secondary benefits: heart failure protection via osmotic diuresis and natriuresis, removal of sodium and water, reducing intravascular volume, lowering preload and afterload decreases cardiac workload, renal protection by reducing the progression of kidney disease. Selectivity: SGLT2-IC50, 1.1 nmol/L, SGLT1-IC50, 1390 nmol/L. This selectivity avoids interference with intestinal glucose absorption. Side effects. Common side effects: genital infections, for example, yeast infections; increased urination, polyuria; mild dehydration or thirst; hypoglycemia, especially when combined with insulin or sulfonylureas. Serious side effects: ketoacidosis, euglycemic diabetic ketoacidosis in rare cases; acute kidney injury, though it can also protect kidneys in specific conditions; urinary tract infections, severe cases are rare. Long-term safety. Studies and trials like DAPA-HF and DECLARE-TIMI-58, showing the benefits outweigh the risks. Contraindications. Absolute contraindications. Type 1, diabetes. Mellitus, T1DM. Risk of diabetic ketoacidosis. Severe renal impairment. eGFR, 30 ml min 1, 73 square meters in some cases. History of serious hypersensitivity reactions to dapagliflozin. Relative contraindications. Caution required. Patients with recurrent genital or urinary tract infections. People with conditions predisposing them to ketoacidosis, for example, starvation, alcohol abuse. Elderly patients are prone to dehydration. Pregnancy and breastfeeding due to limited safety data. Maximum daily dose. The maximum daily dose of dapagliflozin is 10 milligrams per day. This dosage applies across its indications, including type 2 diabetes mellitus, T2DM, heart failure with reduced ejection fraction, HFrEF, chronic kidney disease, CKD. Most popular international brands containing dapagliflozin: Forxiga, brand name. Manufacturer: AstraZeneca. Country: United Kingdom. Farxiga, brand name. Manufacturer: AstraZeneca. Country: United States. Dapagliflozin Viatris, generic. Manufacturer: Viatris. Country: European Union, EU. Edistride, brand name. Manufacturer: AstraZeneca. Country: Australia. Oxra, brand name. Manufacturer: Sun Pharma. Country: India. Adverse events. General adverse events: genital infections, yeast infections, especially in women. Urinary tract infections, rarely severe. Hypoglycemia. Risk increases when combined with insulin or sulfonylureas. Dehydration symptoms: increased thirst and urination. Serious adverse events: diabetic ketoacidosis, more common in patients with conditions predisposing them to ketoacidosis. Acute kidney injury, risk increases in dehydrated patients. Food-related use can be taken, with food, on an empty stomach. No specific dietary restrictions or interactions with particular foods were reported. Drug interactions. Drugs increasing risk of hypoglycemia. Insulin and sulfonylureas. Combined use may cause low blood sugar levels. Diuretics enhanced diuretic effect may lead to dehydration or low blood pressure. Rifampin. Can reduce dapagliflozin's efficacy by increasing its metabolism. Lithium. Dapagliflozin's natriuretic properties may alter the effects of lithium. ACE inhibitors, ARBs, and NSAIDs potentially increase the risk of kidney damage when combined. Food interactions. Dapagliflozin can be taken with or without food. Food does not significantly impact the drug's absorption or effectiveness. Consuming meals with the medication does not increase or decrease the risk of side effects. Pharmacology drug class. Sodium glucose cotransporter 2, SGLT2, inhibitor. Therapeutic uses. Improves glycemic control in type 2 diabetes. Reduces the risk of hospitalization and cardiovascular death in patients with heart failure. Slows the progression of chronic kidney disease, CKD, in at-risk patients. Pharmacodynamics. Mechanism of action. It inhibits SGLT2, which is responsible for reabsorbing 90% of glucose in the kidney. Promotes glucose elimination through urine, glucosuria, leading to lower blood glucose levels. Induces osmotic diuresis, increased urination, which reduces blood volume and alleviates heart and kidney stress. Has a 17% reduction in cardiovascular mortality in patients with heart failure per clinical trials like Dapagliflozin and Declare-TAMI 58. Selectivity. Highly selective for SGLT2 with an IC50 of 1.1 nmol/L. Minimal impact on SGLT1, ensuring intestinal glucose absorption remains unaffected. Pharmacokinetics. Absorption, peak plasma concentration, Tmax, occurs within 2 hours after oral administration. Bioavailability is approximately 78%. Distribution. The volume of distribution is 118 L, indicating wide distribution in body tissues. Protein binding. 91% in plasma, primarily to albumin. Metabolism. Extensively metabolized in the liver. Primary pathway. Glucuronidation by UGT1A9. Produces inactive metabolites. Excretion. Half-life. Approximately 9 hours, enabling once-daily dosing. Eliminated primarily in urine as metabolites. Approximately 75% excreted via urine and 21% via feces. Impact of renal function. Effectiveness decreases in patients with severely impaired kidney function, eGFR 30 ml/min. It is not recommended for patients with end-stage renal disease. Impact of hepatic function. No significant alteration in pharmacokinetics in mild to moderate liver impairment. Chemistry chemical formula C21H25ClO6. Molar mass 408.87 g per mole. Half-life, approximately 12.9 hours, supporting once-daily dosing. Melting point, between 200 and 212 degrees Celsius, indicating a stable solid form. Solubility, moderately soluble in water. Soluble in methanol and other organic solvents. Organic molecule class, belongs to the C-glycoside class of compounds. Includes a glucose derivative and an aromatic ring structure. Bioavailability, approximately 78% when administered orally. References, books, resources, drugs.com. Country, United States. Date, updated on the 30th of August 2018. Study, drug usage during pregnancy and its safety profile. Findings, provided data on safety and pharmacokinetics. Therapeutic Goods Administration, TGA, Country, Australia. Date, reviewed on the 27th of May 2022. Study, safety and usage guidelines. Findings, comprehensive details on adverse effects and approvals. Health Canada, Country, Canada. Date, published on the 7th of July 2016. Study, product monograph updates. Findings, covered clinical efficacy and approval timeline. European Medicines Agency, EMA, Country, European Union. Date, data updated on the 4th of April 2023. Study, approval of Dapagliflozin Viatris. Findings, outlined regulatory approval and clinical recommendations. National Institutes of Health, NIH, Country, United States. Date, data available as of the 3rd of February 2020. Study, pharmacology and adverse events. Findings, highlighted pharmacokinetics, drug interactions, and therapeutic effects.